significant journey towards promoting health and well-being in our community. Today marks the launch of our obesity clinic, a dedicated space where we will address one of the most pressing health issues that is very pertinent today, which is nothing but overweight or obesity. So obesity is just not a personal challenge, it's a societal concern that requires collective efforts to overcome. Our clinic, that is the obesity clinic, is not about judgment or blame, but about providing complete support, understanding, and effective solutions. We believe in fostering a community where everyone can achieve their health, goals, and best lives. As we launch this obesity clinic today, we invite you to be a part of this transformative journey. Whether you are seeking support for yourself, it could be your friend, or it could be your family member. Please note that you're not alone. Together, we can build a healthier, happier, and a resilient community.
Thank you all the audience for coming here for this launch of this very important clinic. Thank you, Mr. Manish, for giving us this opportunity, and Dr. Moinuddin for partnering with us through this journey. Welcome all of you. We'll just take you through a brief introduction as to why we decided to tackle obesity. So we all know we just celebrated World Diabetes Day, which was on the November 14th, and everybody knows that the diabetic epidemic is getting out of control. The epidemic represents nothing short of a global health emergency. That's what the past president of the IDF said. And every 21 seconds, somebody is diagnosed with diabetes. The developing countries like India will bear the brunt of this epidemic, and more than 70% of diabetes live in low and middle income countries. Now, why are we talking about diabetes when this is an obesity, when you're focusing on obesity? This is because 80% of type 2 diabetes is because of obesity. So that is why we felt that if we are able to target obesity, we'll be able to treat a lot of diabetes and the complications. Now, what is obesity? Of course, there has been a stigma associated with obesity because we idealize certain people and we feel, this is what one should look like. But this is a medical condition and it is not, there's no stigma associated. We're trying to remove the stigma associated with obesity. It is defined by WHO. Actually, only in 2012 did the American Association of Clinical Endocrinologists treat it as a medical condition. Okay, and the WHO has defined it as excess or abnormal fat accumulation that poses risk to health. And the CDC says weight that is higher than what is corrected for the given height. And we define it. How do we measure obesity? By the weight. I think most of you would have got a slip with the body mass index. It is measured by taking the weight in kilogram and the square of the height in meters. And this is the normal value, 18.5 to 22.9. Overweight is 23 to 24.9, and obese is more than 25.
Here we are in this one, in a health institution. We just want good health. So what happens here? You need to lose only 5 to 7% of your weight to gain good health, even if you are obese. So if someone is about 80 kgs or 90 kgs, how much do they need to lose? Only 3.5 to 5 kg, or maximum 10% is like 7 to 9 kg. That really is doable, and that will give you immense benefits. So the second thing is this amount of weight loss results in risk factor reduction for heart disease, blood pressure, diabetes, cholesterol control, everything. It can definitely prevent diabetes, 5 to 7% or 10% of weight loss. And weight loss of 10% results in reduction of heart disease. 15 kg weight loss can result in remission. That again is 10 to 15%. You all have heard how much money is taken by people for reversal of diabetes nowadays. So that is what this is about. Very simple, and always have achievable small goals. In 3 months, if you lose 5%, fine. I tell my patients, if you don't gain weight in 3 months, you are doing great. Next 3 months, you can lose the 5%. Nothing will happen. We are on a path. That's all we need to think. Right, this is the last slide. So This is very simple. What is our approach? We will do a complete assessment, including any comorbid condition like diabetes, hypertension, obstructive sleep apnea, like they snore and they get up with a headache, etc. Appropriate diet will be given. It's very easy to give. Lot of people have cravings and that's why they go off the chart. But that is very common and we will manage that. We cannot feel guilty and then feel sad and eat more again. So we will not expect anybody to do 100% compliance. We expect around, I expect around 60%. I don't know about madam.
Yeah, same.
60% is fine. So sleep, so behavior modification, that's why we have a psychologist to manage the stress. And sleep and stress management, exercise under the guidance of a physiotherapy. We have a physiotherapy in our team also. And medications only when indicated. Not everybody you need medicines. And the thing about medicines, the day you start, it will take about 3 months to have an effect. If you stop it after 1 year, 2 years, what was the weight loss due to medicine will come back. It is not a permanent solution. The other thing then is Saab's area, Dr. Moinuddin, that is the surgery. The good part about surgery, it is permanent to a large extent and it is effective very much immediately. Before you discharge the patient start losing weight. But I am not recommending it as the first step. I think you have seen how much time I have spent with the other things. Thank you very much. All the very best.
So we'll have Dr. Moinuddin to come and then probably we'll be open for question and answers. But before that, I think I would just want to take one statement from ma'am. Deepika Padukone, Alia Bhatt. Ma'am, I think Dr. Moinuddin would be able to answer. I bet they would have undergone some surgery, sir. Otherwise, I don't think you would have been here. But anyways, I think Dr. Moinuddin, you would have seen him in Times. Yes, he's won an award, Time Excellence Award recently. A round of applause to Dr. Moinuddin, who is a highly esteemed bariatric and advanced laparoscopic surgeon at Manipal Hospital, Millers Road in Bangalore, and boasting over 9 years of experience. He is renowned for his expertise in weight loss method, and he has successfully performed 5,000 laparoscopic surgeries and 1,000 bariatric treatments.
I think they spoke very high about me. I don't deserve to be that high. So, to be very frank, first of all, I want to thank Dr. Priya Madam for giving me this opportunity, Dr. Sharda Madam, Manish sir, and Dr. Bhavana. So, I feel everyone should know that physical fitness is not metabolic fitness. People who look fit, they'll be walking, they'll be 100 kgs, 120 kgs, 130 kgs. They say, I'm fine, sir. I'm walking, I'm doing my everyday activity. You may not be knowing what is happening inside. Your liver will be going into fatty liver. Your diabetes is getting deranged from pre-diabetic to diabetic. Your blood pressures are rising. Because unless you never check, you will not be knowing what's happening inside. Your cholesterol is going high. And many of the times what happens is sleep apnea. They'll be snoring in the night, but they think it's normal. I'm in the deep sleep and all. No, it's not normal. Sleep apnea is something which is the first sign everyone has to be aware. Because sleep apnea is something fat deposit in the upper respiratory tract, which makes the tract narrow. So whenever you inhale, you get a snoring. Understand, right? The tract is like wide. When the fat deposits, it becomes narrow. So when the air goes inside, it makes a sound, just like flute. When you blow, you get a sound. So basically, sleep apnea is the most dangerous sign, which everyone should be aware of it. And what happens is, any patient has to go like ABCD of this. ABCD is diet, exercise, all this other things, intermittent fasting, medications, and everything, evaluation from our endocrinologist. If nothing works, we are always there. So my part comes like, it's a permanent of losing weight. It's not a temporary. What happens is, when you do surgery, there's the thing. You lose weight, whatever weight. And coming back is very, very rare, because we do most of them. What I'll explain how it is be done. So basically what happens is, people try diets, exercise and all. What happens is, they may lose water weight. So if you see, ID is something different. Age is mentioned, okay? Right side height is there, gender is there. Why gender is important? Gender because males will have more of bone weight, muscle weight, while females will have less. So what I want to say, even though they have less fat in female, it is more this one, more of fat only, not the muscle and bone weight. The number 2 is TW is written here. The third column, TWU. TBW, it is water weight. Everyone should know, see, it is written 40 to 49 is normal. So in this patient, 47. So what happens is, if the patient has 53, 54, they have 4 or 5 kgs of extra body water. when you do diet, exercise and all, they may lose that body water very quick. The people who do diet exercise, first they will lose water weight. So when you stop doing it, you are back again. This is a problem with water weight. You should know how much weight you will lose with non-surgical techniques.
I am Geeta. My question is about diet planning. Should we replace our staple food of rice? And so many people are advising about millets, how far it is effective. Sometimes switching from the natural, what they have to, it may go for some month. Then later they will be returning back to the original thing. So I want to know about that. Second one is management of craving.
Sleep if I don't eat rice. So rice is not all bad. It is the quantity of rice and what you eat it along with. And you know, there's an order of food also that we usually stress on, like eating the fiber first. So you said talked about satiety, right? Fiber, protein, fat, all that improves your satiety. Whereas if you eat only rice, then of course you're going to feel hungry very soon. So we do try to change, and it may be better to avoid white rice. But if there are patients who can't, then they have to restrict the quantity. ಈಗಾಗಿ ನಮಗೆ ನವೆಂಬರ್ 14ನೇ ತಾರೀಕಲ್ಲಿ ವರ್ಲ್ಡ್ ಡಯಾಬಿಟೀಸ್ ಡೇ ಅಂತ ನಡೀತು. ಎಲ್ಲರಿಗೆ ಗೊತ್ತಿದೆ ಡಯಾಬಿಟೀಸ್ ನಮ್ಮ ದೇಶದಲ್ಲಿ ತುಂಬ ಜಾಸ್ತಿ, ಒಂದು 15% ಜನರು ಡಯಾಬಿಟಿಕ್ ಇದೆ. ಯಾಕೆ ಇಷ್ಟು ಡಯಾಬಿಟೀಸ್? ನಮ್ಮದು ಐಡಿಯಾ ಏನಂದರೆ, ಈಗ 80% ಆಫ್ ಡಯಾಬಿಟೀಸ್ ಇಸ್ ಡ್ಯೂ ಟು ಒಬಿಸಿಟಿ. ಸೊ ನಮಗೆ ಒಬಿಸಿಟಿ ಕಂಟ್ರೋಲ್ ಮಾಡಿದರೆ ಡಯಾಬಿಟೀಸ್ ಕಂಟ್ರೋಲ್ ಮಾಡ್ಬೋದು, ಅದು ಒಂದು. ಇನ್ನೊಂದು ಏನಂದರೆ, ಈಗ ಒಬಿಸಿಟಿಗೆ ಒಬಿಸಿಟಿ ಅಂದರೆ ಎಕ್ಸೆಸ್ ಬಾಡಿ ಫ್ಯಾಟ್. ಒಬಿಸಿಟಿಗೆ ಎಲ್ಲರೂ ಅಲ್ಲೊಂದು ಡಯಟ್ ಇಲ್ಲೊಂದು ಡಯಟು, ಸ್ವಲ್ಪ ಎಕ್ಸಸೈಸ್ ಮಾಡಿ ಟ್ರೈ ಮಾಡ್ತಾರೆ, ಅದು ಸಕ್ಸಸ್ ಆಗಲ್ಲ, ಬಿಡ್ತಾರೆ. ಇಲ್ಲಾಂದರೆ ಚೆನ್ನಾಗಿ ಸಕ್ಸಸ್ ಆಗಿ ಬಿಡ್ತಾರೆ. ಅದೆಲ್ಲ ಮಾಡಿದರೆ ಅದು ಲೈಫ್ ಲಾಂಗ್ ಮೇಂಟೈನ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಅದಕ್ಕೆ ಒಂದು ಹೋಲಿಸ್ಟಿಕ್ ಒಬಿಸಿಟಿ ಕ್ಲಿನಿಕ್ ಶುರು ಮಾಡೋಣ ಅಂತ ಒಂದು ಐಡಿಯಾ ಇತ್ತು. ಹೋಲಿಸ್ಟಿಕ್ ಅಂದರೆ ಏನು? ಪೇಷಂಟ್ ಫುಲ್ ಇಡೀಯಾಗಿ ಪೂರ ಪೇಷಂಟ್ನ ಒಬಿಸಿಟಿಯಿಂದ ಏನೆಲ್ಲ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದೆ ಕಂಡು ಹಿಡಿದು ಅದನ್ನು ಟ್ರೀಟ್ ಮಾಡಿ, ಮತ್ತು ಅವರಿಗೆ ಸರಿಯಾಗಿರೋ ಡಯಟು, ಎಕ್ಸಸೈಸ್ ಪ್ರೋಗ್ರಾಮ್, ಮತ್ತು ಕೆಲವು ಜನರಿಗೆ ಸೈಕಲಾಜಿಕಲ್ ಇಶ್ಯೂಸ್ ಇರುತ್ತೆ. ಅದು ಸೈಕಲಾಜಿಕಲ್ ಇಶ್ಯೂಸ್ ಇದ್ದರೆ ಅವರಿಗೆ ವೆಯ್ಟ್ ಅಷ್ಟು ಕಡಿಮೆ ಆಗೋದಿಲ್ಲ. ಸೊ ಆ ಇಶ್ಯೂಸ್ ಟ್ಯಾಕಲ್ ಮಾಡೋಕ್ಕೆ ಕೊನೆಗೆ ಮೆಡಿಕೇಷನ್ಸ್ ಟ್ರೈ ಮಾಡ್ಬೋದು. ಅದು ಸಕ್ಸಸ್ ಆಗಿಲ್ಲ ಅಂದರೆ ಸರ್ಜರಿ. ಸೊ ಎಲ್ಲರೂ ಒಟ್ಟಿಗೆ ಕೆಲಸ ಮಾಡಿ ಟೀಮ್ ಅಪ್ರೋಚ್ ಮಾಡಿ ಹೋಲಿಸ್ಟಿಕ್ ಕೇರ್ ಪೇಷಂಟ್ಗೆ ಕೊಡೋಕ್ಕೆ ನಮ್ಮದು ಐಡಿಯಾ. ಡಯಾಬಿಟೀಸ್ ಅಫ್ಕೋರ್ಸ್ ಅದು ಒಬಿಸಿಟಿ ಕಂಟ್ರೋಲ್ ಮಾಡಿದ್ರೆ ಡಯಾಬಿಟೀಸು ಖಂಡಿತ ಕಂಟ್ರೋಲ್ ಆಗುತ್ತೆ.
ಸೊ ನಮಸ್ಕಾರ, ನಾನು ಡಾಕ್ಟರ್ ಶಾರದಾ. ಇವತ್ತು ನಾವು ಒಬಿಸಿಟಿ ಕ್ಲಿನಿಕ್ ಅಥವಾ ಒಬಿಸಿಟಿ ಪ್ರೋಗ್ರಾಮ್ ಅಂತ ಲಾಂಚ್ ಮಾಡಿದ್ವಿ. ಸರಳವಾಗಿ ಹೇಳಬೇಕಾದ್ರೆ ಬೊಜ್ತನ ಅಥವಾ ಓವರ್ ವೆಯ್ಟ್ ಅಂತ ಹೇಳ್ತೀವಿ ನಾವು. ಸೊ ಇದು ನಾವು ಬೊಜ್ತನನ ಕಡಿಮೆ ಮಾಡಿದರೆ ಡಯಾಬಿಟೀಸ್ ಬರುವುದೇ ಕಡಿಮೆ ಆಗುತ್ತದೆ. ಅದೇ ನಮ್ಮ ಗುರಿ. ಈಗ ಡಯಾಬಿಟೀಸ್ ಬಂದರೆ ಯಾವ ರೀತಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಬೇಕು ಅಂತ ಡಾಕ್ಟರ್ ಪ್ರಿಯಾ ಅವರು ಈಗಲೇ ನಿಮಗೆ ಹೇಳಿರೋದು. ಅದರ ಬಗ್ಗೆನೇ ನಾವು ವಿಚಾರ ಮಾಡಿದ್ದೀವಿ. ಅದನ್ನು ಬರದೇ ತಡೆಗಟ್ಟಲು ಮಾಡೋಕ್ಕಾಗುತ್ತಾ ಇಲ್ವಾ ಅಂತ. ನಾವು ಬೊಜ್ತನನ ಕಡಿಮೆ ಮಾಡಿದರೆ, ಈಗ ಯಾರಿಗಾದರೂ 80 kg ವೆಯ್ಟ್ ಇದ್ದರೆ ಯಾವಾಗ ಅವ್ರಿಗೆ 60 kg ಇರಬೇಕು, ಅವರು 20 kg ಹೆಚ್ಚಿದ್ದಾರೆ ವೆಯ್ಟಲ್ಲಿ, ಅವ್ರ ತೂಕ 20 kg ಇಳಿಸೋದು ತುಂಬ ಕಷ್ಟ. ನಾನು ಅದನ್ನು ಇಂಪಾಸಿಬಲ್ ಅಂತಲೇ ಹೇಳ್ಬೋದು. ಆದರೆ ಒಂದು 5%, ದಟ್ ಮೀನ್ಸ್ 80 kg ಇದ್ದರೆ 4 kg ವೆಯ್ಟ್ ಕಡಿಮೆ ಮಾಡಿದರೆ ಸಹ ಅವರಿಗೆ ಪ್ರೀ ಡಯಾಬಿಟಿಸ್ ಬರುವುದು ಅಥವಾ ಡಯಾಬಿಟಿಸ್ ಬರುವುದನ್ನು ತಡೆಗಟ್ಟಲು ಮಾಡ್ಬೋದು. ಸೊ ಪ್ರಿವೆನ್ಷನ್ ಮಾಡೋಕ್ಕೆ ನಾವು 20 kg ಕಡಿಮೆ ಮಾಡಬೇಕಾಗಿಲ್ಲ. ಒಂದು 5-10% ವೆಯ್ಟ್ ಕಡಿಮೆ ಮಾಡಿದ್ರೇ ಸಾಕು. ಕೆಲವೊಮ್ಮೆ ನಾವು ಎಲ್ಲ ವ್ಯಾಯಾಮ, ಒಳ್ಳೆಯ ಆಹಾರ ಎಲ್ಲ ಮಾಡ್ತೀವಿ, ಆವಾಗಲೂ ನಮ್ಮ ವೆಯ್ಟು ತೂಕ 1 kg ಸಹ ಕಡಿಮೆ ಆಗಲ್ಲ. ಆ ಟೈಮಲ್ಲಿ ಕೂಡ ನಾವು ಯಾವ ರೀತಿ ಚಿಂತೆ ಮಾಡಬೇಕಾಗಿಲ್ಲ. ಯಾಕೆಂದರೆ ನಮಗೆ ಮೆಟಬಾಲಿಕ್ ಬೆನಿಫಿಟ್ ಅಂತ ಹೇಳ್ತೀವಿ. ನಮ್ಮ ಶುಗರು, ನಮ್ಮ ಕೊಲೆಸ್ಟ್ರಾಲು, ನಮ್ಮ BP, ನಮ್ಮ ಹಾರ್ಟ್ ರೇಟು, ನಾವು ಉಸಿರಾಡುವುದು, ಲಂಗ್ ಕೆಪ್ಯಾಸಿಟಿ ಅಂತ ಹೇಳ್ತೀವಿ, ಎಲ್ಲನೂ ತುಂಬ ಚೆನ್ನಾಗಿ ಇಂಪ್ರೂವ್ ಆಗುತ್ತೆ ನಾವು ಒಳ್ಳೆ ಜೀವನ ಶೈಲಿನ ಪಾಲನೆ ಮಾಡಿದರೆ. ನಮ್ಮ ಇಡ್ಲಿನೋ ದೋಸೆನೋ ಆವಾಗ 3 ಇಡ್ಲಿ ಬದಲು 1 ಇಡ್ಲಿ ಸಾಕಾಗುತ್ತೆ. ಆ ರೀತಿ ನಾವು ಬೊಜ್ತನನ ಸುಲಭವಾಗಿ ಪರ್ಮನೆಂಟಾಗಿ ಟ್ರೀಟ್ ಮಾಡ್ಬೋದು. ಆಲ್ ದ ಬೆಸ್ಟ್.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ನಾವು ಡಾಕ್ಟರ್ ಮೊಯಿನುದ್ದೀನ್, ಬೆರಿಯಾಟ್ರಿಕ್ ಆ್ಯಂಡ್ ಅಡ್ವಾನ್ಸ್ ಲ್ಯಾಪ್ರೋಸ್ಕೋಪಿಕ್ ಸರ್ಜನ್, ಮಣಿಪಾಲ್ ಮಿಲ್ಲರ್ ರೋಡ್ನಲ್ಲಿ. ನಾವು ಡಾಕ್ಟರ್ ಪ್ರಿಯಾ ಚಿನ್ನಪ್ಪ, ಡಾಕ್ಟರ್ ಶಾರದಾ ಎಲ್ಲರೂ ನಾವು ಒಂದೇ ವೇದಿಕೆಯಲ್ಲಿ ಸೇರಿ ಡಿಸ್ಕಸಿಂಗ್ ಅಬೌಟ್ ದ ಕಾಮನ್ ಪ್ರಾಬ್ಲಮ್ ಆಫ್ ಒಬಿಸಿಟಿ, ದಪ್ಪದನ, ಡಯಾಬಿಟಿಸ್ ಅಸೋಸಿಯೇಷನ್ ನಾವು ಡಿಸ್ಕಸ್ ಮಾಡಿದ್ವಿ. ಇನ್ನು ಮುಂಚೆ ಬೇರೆ ಬೇರೆ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ಡಯಾಬಿಟೀಸ್ ಬಗ್ಗೆ ಒಂದು ಡಾಕ್ಟರು, ಡೈಟ್ ಬಗ್ಗೆ ಒಂದು ಡಾಕ್ಟರು, ಸೈಕಲಾಜಿಕಲ್ ಬಗ್ಗೆ ಒಂದು ಡಾಕ್ಟರು, ಸರ್ಜಿಕಲ್ ಬಗ್ಗೆ ಒಂದು ಡಾಕ್ಟರ್ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಇವಾಗ ಈ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ನಾವು ಮಲ್ಟಿ ಡಿಸಿಪ್ಲಿನರಿ ಅಪ್ರೋಚ್, ಹೋಲಿಸ್ಟಿಕ್ ಅಪ್ರೋಚ್ ನಾವು ಮಾಡ್ತಾಯಿದ್ವಿ. ಪೇಷಂಟ್ ಏನೋ ಒಬೀಸ್ ಇದಂದರೆ, ಲೆಸ್ ಒಬೀಸ್ ಇದಂದರೆ, ಪೇಷಂಟ್ ಕೆಳಗಡೆ 30 ಕೆಳಗಡೆ BMI ಇದೆ ಅಂದರೆ ಪೇಷಂಟು ಡಾಕ್ಟರ್ ಪ್ರಿಯಾ ಚಿನ್ನಪ್ಪ, ಡಾಕ್ಟರ್ ಶಾರದಾ ಆ ಥರ ಹೋಗ್ಬೋದು, ಸಜೆಸ್ಟ್ ಮಾಡ್ತಾರೆ. 30 ಮೇಲೆ BMI ಇದಂದರೆ ನಾವು ಸರ್ಜಿಕಲ್ ಅಪ್ರೋಚ್ ಮಾಡ್ತಾಯಿದ್ವಿ. ಇನ್ನು ಒಂದೇ ವೇದಿಕೆಯಲ್ಲಿ ನಾವು ಎಲ್ಲ ಪ್ರಾಬ್ಲಮ್ಸ್ 360 ಡಿಗ್ರಿ ಪ್ರಾಬ್ಲಮ್ಸ್, ಒಬಿಸಿಟಿ ಆ್ಯಂಡ್ ಡಯಾಬಿಟೀಸ್ ಬಗ್ಗೆ ನಾವು ಸಾಲ್ವ್ ಮಾಡ್ತಾಯಿದ್ವಿ. ಸೊ ಏನದು ದಿಸ್ ಕೈಂಡ್ ಆಫ್ ಥಿಂಗ್ ಈಸ್ ಅ ಫಸ್ಟ್ ಆಫ್ ಇಟ್ಸ್ ಕೈಂಡ್ ಇನ್ ಬ್ಯಾಂಗ್ಳೂರ್. ಸೊ ಇನ್ನು ಮುಂಚೆ ಏನೋ ಹಾಸ್ಪಿಟಲ್ಲು ಈ ಥರ ಮಾಡಿಲ್ಲ, ನಾವು ಫಸ್ಟ್ ಟೈಮ್ ಮಾಡ್ತಾಯಿದ್ವಿ ಈ ಥರ. ಸೊ ನಾವು 360 ಡಿಗ್ರಿ ಕೇರ್ ಪ್ರೊವೈಡ್ ಮಾಡ್ತಾಯಿದ್ವಿ ಎಲ್ಲ ಪ್ರಾಬ್ಲಮ್ಸ್ಗೆ, ಸ್ಟಾರ್ಟಿಂಗ್ ಫ್ರಮ್ ಸೈಕಲಾಜಿಕಲ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಟು ಡೈಟ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಟು ಎಕ್ಸಸೈಸ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಟು ಪೇಷಂಟ್ಸ್ ಹೂ ಆರ್ ಟೂ ಮಚ್ ಒಬೀಸ್, ವಾಕ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ, ತುಂಬ ದಪ್ಪ ಇದೆ ಪೇಷಂಟ್ಸ್ಗೆ, ಅನ್ಕಂಟ್ರೋಲ್ ಶುಗರ್ ಇದೆ, ಅನ್ಕಂಟ್ರೋಲ್ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಇದೆ, ಸ್ನೋರಿಂಗ್ ಇದೆ, ಸ್ಲೀಪ್ ಆ್ಯಪ್ನಿಯಾ ಇದೆ, PCOD ಇದೆ, ಇನ್ಫರ್ಟಿಲಿಟಿ ಇದೆ, ಎಲ್ಲ ಪೇಷಂಟ್ಸ್ಗೆ ಒಂದೇ ವೇದಿಕೆಯಲ್ಲಿ ನಾವು ಅಡ್ರೆಸ್ ಮಾಡ್ತಾಯಿದ್ದೀವಿ ಪ್ರಾಬ್ಲಮ್ಸ್ಗೆ.